Okay, welcome back everyone to Placement Series. So we're now diving straight into MSK placements, and really pleased to be joined by Sara Hill, who is currently Band 7 MSK Physio at Ashford and St Peter's NHS Foundation Trust, and is also Head Physiotherapist at the Rams Rugby Football Club as well. So welcome to the channel and welcome to the series, Sara.
Thank you very much.
So thank you for your time. It's really good to have you on. We're now kind of looking at MSK placements, and we're going to cover the same format as we have done with the other ones in looking at how students can prepare for their MSK placement, how they can get the most out of the placement, and also what to expect. And I think MSK is often looked at as, you know, it's quite again, scary placement. I think all placements are scary when you get close to going on them. You get excited and then you get scared as you're about to go on them. But I think really it'd be good to kind of delve into what sort of things students should know before they start, and also then what are they like to be doing. So we'll kickstart it, I think, with preparing. And the big one on this one really is what, from an educator, so you're currently an educator and placement coordinator as well, what you think students should do to kind of get prepared for their MSK placements.
Absolutely. I think really important few things to cover is having a good understanding of your basic anatomy. It's really hard to go through and progress with your MSK placement if you don't understand which muscles are involved in certain joints and where those main structures are. Mm-hmm. And that's really important to help with your clinical reasoning. The other thing that's very important is having a good understanding of your red flags, but not just what those red flags are, but why you're asking them. And think about the questions that you want to use to ask those to the patient and how you might want to phrase them. And the other thing is also having a good understanding of your common conditions. So things that we routinely see. So your tendinopathies, arthritis, ligament sprains, and those sorts of things. Okay. I think one of the other things that people tend to, or students particularly, fall into a bit of a trap is overcomplicating their assessments as well. Mm-hmm. So that's also something that I see quite commonly as well.
Yeah, definitely. No, it's been a common theme for doing these and other interviews as well, is the overcomplication of assessment and treatment as well. So kind of let's go into a couple of those things. So anatomy, good to have a good grasp of anatomy, but how much detail should students go into? Because obviously when you're at university, we are taught and it's different in every university, but ultimately your origins, your insertions, your nerve roots, etc. How much of that is really critical, would you say, going into your MSK placements?
Well, I certainly think it's very important, to be honest, because if someone says to you that, they're struggling with knee pain, mm-hmm. and you've got no idea which structures are in that area, then you're going to have a hard job trying to come up with your hypothesis and analysis and conclusion. It makes it virtually impossible. So you're not necessarily looking for, exact pinpoint accuracy of every single muscle, but particularly your main muscle groups and roughly which area they might refer pain to. One exercise I often get students to do is, write down, so ankle, for example, and then create a chart of all those structures that are in that area to sort of break out from, and then actually can try and complete that for each joint. So you kind of build up a bit of a map really of those structures that can cause problems with.
Okay, yeah, so that's good. So in terms of having a good basic anatomy of an origin, insertion and action, would you say as well? So knowing what that muscle group or muscle specifically does.
Yeah, absolutely. And the other thing as well is, we all, from time to time we'll look things up, which is normal. We've not come across something for a little while, but as well having a good understanding of your dermatomes and myotomes and reflexes and a rough understanding of the levels that you're looking to. I think most students will remember dances and things that you come up with when you're trying to learn learn them all. Yeah, that's the one. So it's having an understanding of that, so that it just makes it easier to help you understand and work out what might be the patient's problem.
Yeah, definitely. I quite like the one you mentioned there as well about the red flags, because I think we reel off red flags, and I'll never forget my first MSK placement where I was with a patient and I was going through my red flags, and I can't remember what it was they asked. But anyway, I was asking them, and the patient turned around and said, "Oh, why are you asking me that?" And I just went blank. And it from that point onwards, I've never asked a question that I don't know why I'm asking it, because it made me feel so awkward. So kind of like understanding why you're asking those questions is quite.
Yeah, I think that's always a very important thing as an MSK physio. We do need to be good on our red flags, but also, as I said earlier, it's how you're asking them and know what you're asking them for. And I come across this with students and band fives as well, is that they get really concerned about something when actually it's not necessarily too much of an issue. So particularly one being night pain. Well, obviously, you're really asking that because you're looking for unremitting night pain, not necessarily if someone's turning over, rolling over in bed, and then that painful area. So it's knowing the differences between the two.
Yeah, definitely. Okay, so that's fantastic. So and having that ability to phrase and frame questions in the most appropriate way. Would you say some of that it does come with practice though? If it's your first.
Oh yes, absolutely. I think when most students try their first subjective assessment, it all comes out a bit higgledy-piggledy, and you can see everyone's usually quite nervous and forget things as your thoughts are racing. You're trying to cover everything, so that's normal. There's nothing to worry about, and it just comes with practice. The more you practice, the easier it gets. And the idea is that you want it to become a natural conversation, rather than it coming across very scripted and question answer, trying to stick to what you have, which is fine to start with. Everyone has to start somewhere, but that's your aim that you're looking to try and achieve.
So then you mentioned some of the common conditions that would be good for students just to have a bit more awareness of. So which ones would you say? You mentioned a few already, but yeah. So some of the things that students should go away and just have a bit of a good understanding of those conditions, because that's what they're likely to see.
So, I mean, it's very normal that when, as a department, that you're expecting a group of students, is that we prioritise the referrals, hopefully, into things that are student friendly. We don't always get it right, depending on how what's written on the referral, but we try our best to provide referrals that we think are appropriate. So these will usually, as I said, will include arthritis, OA, which obviously we see a lot, tendinopathies. We get a lot of shoulder pain. I think my current students are I've seen so many shoulder pains over the last 6 weeks. So a lot of rotator cuff issues. Those are plantar fasciopathy. Those are really the common things that we usually get students starting off seeing.
And especially with the tendinopathies, half of it's keeping up with where the research is with tendinopathy at any one point, because it seems to evolve very quickly, doesn't it?
Yes, changes all the time, and that's for all of us. How we used to treat things 5 or 6 years ago changes. So obviously it's keeping up with that. And I think the other thing that often isn't always covered at university is your exercise sort of repertoire or toolbox, as it were. And I know when I went on my first MSK placement, I had no idea about exercise. Just hadn't really been covered as to what exercise you do to treat certain things. So trying to build that up as well is also a real help, and that's usually something I find that students haven't always covered that much before.
I think and it's also that how to regress and progress those exercises.
Absolutely. And often when you're looking through research articles and journals, they'll talk about exercise, but they very rarely actually put in the exercises that are included. So that doesn't really help you either. So again, it's difficult, but actually YouTube these days is a fantastic resource to find lots of these sorts of information that wasn't really around so much when I was training. Twitter and podcasts and all those things that you now have access to really try and build up your knowledge of exercises.
I think one of the things I think I was given to do actually was just to take a couple of exercises, simple things. It could be just a bridge or something like that, and just practice looking at, okay, how would you make that easier for a patient? How would you make it harder? What would you want to?
And give them a go yourself as well, because in your head you might think, oh yeah, that seems quite easy, but actually, if you try it and see how you find it. How hard do you find it? Do you think this 80-year-old lady is going to be able to do some of the exercises that you're asking them to do? And that's the other thing that we usually find as well, is that students aren't always appropriate with their exercises that they're initially given. So really think about your patient and who you have and what you feel is going to be appropriate for them.
So that's fine. So that's a good kind of overview of what to prepare. So ultimately it's not going hell for leather on your preparation and as if it's an exam before you've even turned up, but just brushing up and just making sure you've got a good broad knowledge of your anatomy, some conditions as well, and maybe some bit of exercise ideas, some exercises, but I think that will probably come when we go on to the next bit. So we're going on to placement. So if I'm a student coming on to placement, what might I expect on an MSK placement? What sort of things might I expect to see and do?
Well, obviously, I'll kind of talk about from if a student comes onto one of my placements, I do. Obviously, I can't take into account every department works a little bit differently. So obviously, to start off with, usually a student will observe for a few days or a week, depending on how they're getting on, just to make sure they feel like they're settled, and try and spend some time with other members of staff, because we all work slightly differently. And then what we usually get students doing is gradually building up with their subjective assessments, and then start thinking about their objective planning, and then obviously moving forward to doing the whole assessment. And then it's about putting it all together, which is often the tricky part, is that you have your findings and then you're not quite sure what to do with it, and that's where you're then looking to really build up with your clinical reasoning. And one thing that we often talk about a lot is pattern recognition. So the more times you see something, you start to recognize, oh, that's what that is. And then if you've seen that a few times and you've treated it successfully, then you feel more confident in recognizing it the next time. So that's how I kind of build the student up throughout the placements, so that hopefully as they start progressing through the weeks, they start taking on these assessments independently, and I'm just there if needed. And also looking to build up a nice sort of small caseload for student as well, so that they follow on with these patients and can check how they're progressing, and is their management working. So that's usually, and also as well, sort of taking part. Often lots of MSK departments will run lots of different classes. So usually it's a good idea for a student to get involved and take part of those as well.
And those classes are quite good as well. If you're a student who feels that they haven't had a great deal of input in terms of exercise prescription, some of the classes are a great place to get some of the exercises that you might give to patients as well. And then that's quite a nice one. It's a bit of a cheap way of doing it, but yeah, so that's good. So you've covered on the things there. So a student, obviously we're going to be doing our subjective objective. We're then looking at clinical reasoning in our analysis, and then creating a plan of treatment, and then following that through with our follow-ups, etc. What sort of treatments might a sort of student would you be expecting them to potentially see them doing? Now I'm thinking, obviously there's I think a student nowadays looking at social media, I think there's no escaping from the whole manual therapy conversation, and we're not going to go down that rabbit warren today at all. But kind of how much of those skills and other skills might you expect to see a student do?
Well, I suppose now is probably a good time to say I've pretty much been working at home for the last year, apart from one day a week, and most of my students have been working remotely or virtually. So obviously we've been very exercise based, because we don't have access, can't get hands-on with the patient. So yeah, very much sort of exercise-based functional exercises, and rehab with our patients. And I think the other thing that's very important that's often forgotten about is the patient education. Yeah. And how important that is. So again, another reason why you need to have a good understanding of your common conditions, because you need to be able to educate your patient on them. Absolutely. I usually want students to spend as much time on the education as they do running through their exercise prescription, because that's so important.
Especially if you've got a patient who's anxious or just doesn't understand what's going on, being able to, and also is it that you need to have a good understanding of something to be able to put it across in a very simple way as well. That's the skill.
Absolutely. And your patient isn't going to be compliant with your really nicely, how amazing those are put together, and they might be perfect, but if that patient doesn't understand why they're doing them in the first place, then they're probably not really going to do them at all, and you're just going to end up going around the houses. So yeah, your education and how you explain your reasoning behind the what you produce through your exercises, and all those factors that go into patients' pain, are all really important.
Yeah, definitely. Yeah, a big area as well with pain and everything that comes alongside that as well. Okay, so obviously at the moment it is different because of the situation that we currently find ourselves in. So for those of us watching this now, looking back at COVID, hopefully a little while ago, when we're back in clinic with face-to-face appointments again there, so what sort of things might a student hands-on would you be looking, kind of what sort of skills might you be looking for them to have or to gain while they're on placements?
We're certainly looking for students to build up with their sort of manual therapy techniques or ideas of what's available. And often we talk about having a toolkit of your treatment options that are available to you. So it's just building that up. And as I said, we mentioned it earlier, every physio will have their own things that they like to do and things they believe or don't believe, but it's important to have a good understanding of everything that is available that you could do. So that's what I would usually suggest is again building up those different areas really.
Yeah, I want about sort of handling as well, those handling skills, because that's part of the issue as well. You learn it with with each other at university, because we're all sort of doing patient handling with each other, so you get to sort of feel what, as I say, a normal or non-pathological or healthy joint feels like. But then when you get a patient who is actually in pain and your handling skills, have you got any advice to students about sort of coming onto placement and then having that sudden handling a real patient and how they can settle into that?
I usually find it's just a bit of just a confidence thing. And as soon as you start feeling sort of limbs or moving them around, then it all just becomes much more naturally, and just being confident with it. So then the patient feels more secure with what you're doing. And yeah, it doesn't take long to build up that knowledge of what an arthritic joint feels like. And obviously, if someone has pain when you're moving, then you're not going to, go through all your over pressures and really push through, if it's really painful. So it's just being mindful and having that, eye contact with the patient as well. So you can look at their reactions, as to what you're doing and how that's affecting them. So yeah, that just comes naturally as the placement progresses, really.
Just something else that's come to my head as well is obviously we've got with particular or specific joints, you've got these special tests, and there's so many out there. What's your advice to students? Is there a certain ones or certain things that you think they should sort of prepare for a little bit, or is it a case of wait until you come on placement, or how do you think students should prepare for the amount of special tests that there are when they start looking?
You're right, there's quite a lot of them. And again, that's a difficult one to answer, because every physio or educator you have will do slightly different things. But I think it's important to have an understanding of the tests that are around there and the common ones that are used, particularly obviously for your knee special tests. Those are always my favourite. as a student to practice those. Yeah, you'll get things like the Physio pocket book, guidebook, which has them all nicely listed with a little description. Again, that kind of comes as the placement progresses, really, not necessarily something that you necessarily need to do too much preparation on or so on.
That's quite good. So yeah, because I know if you sometimes if you look at the amount of tests there are, to think, oh my goodness, how am I going to remember all of that before I go on placement would be it's incredibly daunting. But maybe just some of the key ones. So pick a joint and just pick a couple of key ones, because obviously you may, especially say with the shoulder, for instance, you might cluster some of those tests together as well anyway. And then I suppose that comes in with your anatomy and understanding the movement and how that special test and what you're testing for. Obviously, I don't know how much you go into sort of specificity and sensitivity of those tests, but if you're looking at your real clinical reasoning, it might be worth knowing. I don't know how much you expect students to know on that.
I wouldn't probably necessarily expect a student to I'll be really impressed if they did, but no, I wouldn't necessarily be expecting that to start off with.
Okay, so there's a few things now that kind of reduce some anxiety, I think, actually, because I know some students look at that and think that they do have to know all of that. So
yeah, I think you're really looking at the importance of your patient's history, and what they're describing and saying to you are the key things.
That subjective is just unbelievably important. Yeah. With that on subjective assessment, because obviously you could spend, I mean, I know when I did on placement, I felt like I could spend the whole morning taking a subjective assessment from a patient, because you can just get chatting to them. And that kind of leads nicely onto the timings, because in an NHS setting, we're not blessed with hours and hours of time for each appointment. So have you got any sort of tips for students in sort of helping them with their time management with patients?
Yeah, I think time management is often a tricky thing that students struggle with. I think one thing that we often talk about, if it is an issue, is you must, should, and could lists, which is quite a common strategy or technique that educators will use to help you with your objective planning. Often we find that students just try to assess everything, where and that takes a long time. So you're really looking at, okay, well, what do I really need to assess? What is vitally important? The idea is that once you've finished your subjective assessment, is that you should have quite a clear working hypothesis, and your objective is really looking to confirm that. Right. So on your must list, you're looking at, okay, well, what objective tests can I do to confirm my hypothesis? And then if you're not sure after that point, that's when you go to your should and could. So that's kind of the easiest way to manage with time. But again, that just builds up throughout the placement and coming across different patients. Some, you feel like you're trying to really dig with them and trying to get, poor historians aren't giving you much information, and it can feel like hard work. And you'll get other patients who tell you and go off on a tangent and tell you all completely unrelated information, and your job is to try and bring them back into what's relevant. So it is a skill, but often it's that planning that objectively that is the issue, and then the writing the notes. I tend to find that students actually get the assessment done in time. It's just that note writing that can take much longer.
Okay, that's brilliant. I think we've covered loads there actually, but particularly I think about just helping students feel a little bit less overwhelmed. And I think there's a common theme through a lot of this. I think as students, we put a lot of pressure on ourselves to do a lot before placement, and feel like we need to know everything about everything before we come on placement, and that's not necessarily the case. But getting some core things that you've mentioned is going to put students in a really good position to have a good placement. So that again leads nicely onto how to get the most out of placement, and I think a lot of these tend to be quite broad across all placements really, but what are your kind of go-to pieces of advice for students to make sure they try and get the best out of placements?
I think, personally, for the students that I think back to, they've done really well. They're the ones who just have a really good attitude. So they're very keen and enthusiastic, and they're, like a sponge, and soak up everything that you're telling them, and do work hard throughout the time that they're with you, and show interest. It's hard as an educator if most of us do it because we enjoy it, and so we want to help the student as much as possible. But if you're not getting much back from them, then it can always be a bit more of a challenge. So ask lots of questions, try and be confident with what you're trying to achieve, and just try and enjoy and embrace it, really, and then you'll do well.
It's good. I think, as I say, it does cover a lot of placements, but it's specifically, I think sometimes, do you think students don't ask questions because they don't, if they ask the question, it's admitting that they don't know and that they're going to get, it's frowned upon?
I think that's a very common thing. I'm sure any placement is scared to get things wrong, which I don't think it should be that way. I always say to my students, there's no silly questions, and if you're not sure about something, just ask, because then you never sure. So that is very common. I was exactly the same when I was a student on placements. I was always rubbish at asking questions, and probably didn't ask enough because I didn't want to think, oh, she doesn't know that. The other thing I find is that when you do ask a question, I'm fairly certain that most of the time that answer is the first thing that comes into your head, but people, because they don't want to be wrong, they don't say it. Whereas go with your gut feeling. You're probably right.
And that is it's just such a massive fear. I've covered on lots of other videos that we've done, that the mistakes, fear of making a mistake as a student, and it can be quite debilitating, I think, as a student. If you're too fearful of making a mistake, then you never put yourself in a position where you can learn, because after all, you make a mistake, and that's where you often get the best learning opportunities. Putting yourself out there and giving it a go is always a good idea. First thing you think of may be the right thing anyway.
I think it usually is, to be honest.
Fantastic. I think, well, that's brilliant. I think we've definitely covered loads of things there that would help students, I think, going forward into their MSK placements, to, again, really alleviate some of those anxieties and the fear that just goes along with placement. As I said earlier on, a lot of times students are really excited, and then when placement is 2 or 3 weeks away and we're emailing our educators to introduce ourselves, the nerves just really hit. So hopefully some of these things it will take away some of the unknowns and give some focus on what to do to prepare for these MSK placements and get the most out of it and enjoy it, because that's what you should do on placement. I think it should be fun. So brilliant. Thank you very much, Sara. That's fantastic. Thank you very much for your time. And like I say, like with everyone else, hopefully maybe get you on another time to go through something specific to do with MSK would be great.
No problem at all.
All right. Thanks, Sara.
Thanks.